Hi, everyone. My name is Miles, and I will be your EMRA Head Coordinator for the upcoming academic year. Today, myself and the rest of our coordinator team will be talking to you about the Emergency Medicine Research Associates. So why do we exist as an organization? Well, according to a paper published by Dr. Judd Hollander, which wrote about ED undergraduate research programs like ours, the single largest impediment to prospective EM clinical research is the ability to collect data. To break that quote down a bit, let's talk about what prospective research is. Prospective research follows individuals over time, and data is collected on them as their characteristics change. In contrast, retrospective research selects an individual and information is collected on them from their past. Now, prospective research has advantages such as minimization of bias and confounding variables, but often this can be time-consuming and inefficient for providers that are more focused on patient care. That's where we as EMRAs find our niche of selecting, consenting, and enrolling eligible patients for research studies run by the ED. As individuals looking to enter healthcare fields, which I'm sure many of you are, EMRA's highest priority is on patient care, and we do so by advancing the practice of emergency medicine through clinical research. By helping advance the field of medicine through data collection, we aim to improve the lives of both patients and providers. We do this specifically through our mission to assist with ED faculty conducted clinical research studies and provide volunteers educational opportunities for professional development. Our roles as research associates inherently have somewhat of a symbiotic relationship with ED faculty, and that while we help them collect data for their studies, we're also privileged with ED exposure and access to many educational and developmental opportunities. Now, obviously, the second part of that is going to be the ED faculty. So next up, we're going to have Trisha come talk to you guys about our sponsors.
Hey guys, so as Miles mentioned, one of the highlights of the EMRA program is our relationship with our faculty sponsors and other resident and fellows in the UCLA Ronald Reagan Emergency Department. So our close relationship really allows us to gain mentorship experiences as well as research projects to help the continuous growth of the program. So to kind of introduce you guys to some of our faculty sponsors, this includes Dr. Maurer, who is listed on the left. He's actually the founder of EMRA, and he's also one of the principal investigators for our Abdominal CT study. And then next on the right is Dr. Hendy. So Dr. Hendy is the department chair for the emergency department here at Reagan, and he's also the principal investigator for our Clovers study. And then to the right of Dr. Hendy is Dr. Cooper. Dr. Cooper is our research director here for the emergency department. And she works extensively with our research and mentorship committees to kind of give us as many opportunities as possible to grow throughout the program. And then on the right, we also have Dr. Schreiger, who is also the emergency department vice chair. So now that I've kind of talked a little bit about our faculty, let's talk a little bit about who we are. So EMRA is a team of 30 to 40 volunteers who serve as the dedicated eyes and ears of the UCLA Emergency Department's Clinical Research Division. So we operate both in the emergency department as well as a separate office on the 8th floor of the hospital from 8 a.m. to midnight, 7 days a week, to screen, consent, and enroll patients into our clinical studies. And to me, EMRA is the most valuable organization I have joined on campus because you not only get an in-depth look at emergency medicine and clinical research, but you also get to take part in our committees and a greater community of like-minded individuals with the same passion as you. So now that I've told you a little bit about who we are, my fellow coordinator Rithik is going to explain to you guys what we are not.
Thank you, Trisha. And with these excellent opportunities for patient interaction, physician shadowing, and clinical research comes a lot of responsibility. Although we are afforded access to the Ronald Reagan Medical Center and the ED, it is important to know that we are not healthcare professionals, and as such, our activities cannot infringe on aspects of patient care. For example, we are not allowed to offer medical advice to patients. In addition, our role in the ED is gifted to us by research experts who we work with collaboratively to perform data collection activities and more. However, due to the intensive nature of the research performed, members do not generally engage in data interpretation and analysis. With that said, EMRA offers multiple opportunities for clinical exposure and research as our faculty, sponsors, and staff clinical research team understand and heavily support research associate involvement wherever applicable. Our duties as EMRA associates are foundational for the execution of ongoing clinical research at Ronald Reagan. With clinical research primarily being completed in hospital and clinic environments, EMRAs engage in a unique form of research that allows them to not only gain knowledge on research proceedings, but also gain patient exposure. Roughly, most of our studies involve the following responsibilities: screening for qualifying patients, communicating with healthcare staff, assisting in obtaining informed consent from patients, and collecting data through a variety of metrics for some studies. Screening for patients, for example, allows EMRAs to utilize their in-depth knowledge of scientific research to look for qualifying patients and eventually approach physicians to move forward with patient consent. Although specific EMRA duties are dependent on the individual study being conducted, EMRAs are able to engage in high-level clinical research that can be found across the professional sphere, including the pharmaceutical industry and academia. As such, EMRAs are equipped with professional experiences that serve valuable for a variety of professional healthcare research careers, as they are able to interact with physicians and patients for study enrollment. If you have any further questions about what clinical research is and EMRA's role in ED clinical research here at Ronald Reagan, feel free to contact us. And now Sarah will discuss the EMRA experience.
All right, so we want to iterate that the EMRA experience goes beyond what we do on shift. So being on shift allows us to have an excellent exposure to medicine through reading patient charts, interacting with physicians, and having firsthand exposure to the healthcare team's work, such as observing trauma resuscitations in the level 1 trauma bay. And of course, helping with clinical research enables our members to learn more about the clinical research design and execution through the different stages of research. Outside of shift, EMRAs have a plethora of opportunities to get involved. One such opportunity is shadowing physicians in the emergency department and having a close-up encounter of patient-physician interaction and asking questions that they might not have had the chance to ask before. Not only that, but EMRAs are also invited to attend educational events such as resident training sessions, lectures held by attendings and residents on a variety of topics, and journal clubs where physicians come together to discuss very exciting and interesting research articles that they came across. They also receive a lot of mentorship from not only physicians, but also from program alumni who have graduated and gone on to become medical school students or healthcare professionals themselves at this point in time. The mentorship consists of either one-on-one or group advising sessions where our mentors help us with anything from discussing their career trajectories to giving medical school admissions tips. And speaking of medical school admissions, for those of the EMRAs who are interested in pursuing medical school after college, they have access to Q&A sessions, AMCAS workshops, and AMCAT resources, amongst many other resources that we provide. In addition, there is also professional development events such as resume and CV reviews and mock interviews that are of great help to everyone regardless of their future career plans. Finally, as a research associate, EMRAs receive SRP 99 credits if they attend UCLA, and they can also request for a letter of recommendation from a faculty sponsor after successfully completing the program. We have all of these resources available for our members, but we cannot forget the amazing peers we surround ourselves with and the inspiration and the motivation they serve to one another, and as we share the same passion for healthcare and research. And last but not least, we do have our amazing emergency medicine jackets that we wear to different places to really represent our organization and who we are. So I hope that gave you a little bit of a holistic picture of who we are and what we have to offer you. And so going on from here, Kyle will discuss some of the studies that we have assisted with in the past.
Yeah, so since its inception, EMRA has contributed to a wide variety of clinical research studies. And listed up here, we have some of our more recent studies that have been published and completed. So on your guys' left, we have the pediatric pulse oximetry variation between respiratory diseases study. This was largely a data gathering study that was looking at what type of O2 saturation levels were normal and abnormal in pediatric patients. On another end of the spectrum, we also have one that's called outpatient venous thromboembolism management. And this is a completed study that also looked at an outpatient study looking at various types of antithrombotics for patients with VTE. And what this was looking at is basically looking at how disorders and pathology such as these can be treated in an outpatient setting outside of the ED, in which treatments were advantageous over others. And then another one of our recent studies was the whole blood study. And this is one that was looking at comparison of different types of transfusion therapies in acute traumas and resuscitations, and looking at which ones were more efficacious. This is actually a study that EMRA has actually had additional opportunities to participate in hands-on with actually running some of the data analysis. So you guys can see through a wide variety of these studies that we have, there's a great level of depth and breadth to these studies that covers a wide variety of wide spectrum of diseases. And one study that was actually completed many years ago, over a decade ago, was external validation of San Francisco syncope rule. And what we found here through this study, through a lot of data collection, analysis by other PIs, was that this syncope rule that was developed of SF was in fact valid, but actually was less sensitive and specific than was previously reported. So these studies refer to a wide variety of clinical research studies in the ED. And in many cases, EMRAs have been recognized for these studies and have been mentioned and acknowledged in manuscripts. So we'll be moving on to some of the next slides with current research, and Kevin will be talking about that, starting with clovers.
Excellent. So yeah, you guys heard a little bit about our past research, and something that really differentiates EMRA is that all members are responsible for all of these studies. So this is a really great way, as Kyle mentioned, to get a really wide exposure to different types of research in the hospital, and also go more in depth in certain subjects that you might be more interested in. And really the purpose as we go through some of these studies is not for you guys to memorize information about each study, but really just to get a better idea of what an EMRA actually does on shift, and if you can see yourself doing that. So as one of our first studies to show you guys is the Clovers study. And Clovers is basically stands for crystalloids, liberal, or vasopressors early resuscitation in sepsis. So kind of lengthy. Essentially what that's asking is, do we want to give patients more fluids, so crystalloids liberal, or do we want to give them less fluids by giving them medications to raise their blood pressure first, so vasopressors? Essentially, it's looking at fluid treatment strategies for sepsis. Sepsis is basically when you have a localized infection or some type of immune response that becomes systemic because you have bacteria or you have different pathogens that enter your bloodstream. So as a result, you get systemic inflammation, you can get organ failure, and ultimately even death. So sepsis, very complicated medical condition. Essentially what this study is getting at is, what should the standard of care be for patients who are in septic shock? Do we give them more fluids, or do we give them that medication first? And which approach is ultimately going to help patients survive if they come into the ED in septic shock? What EMRAs do when you're actually on shift screening for sepsis is you're with that patient from the moment they enter the ED to the moment they actually get enrolled in the study. So you're screening them when they come in, you're looking at their blood pressure, you're looking at any medications ordered for them or any blood cultures ordered for them. You're communicating with different nurses, different research staff, and also the doctors that are taking care of these patients. And ultimately what the goal is there is to get them into one of two arms of this study, either fluids liberal or vasopressors early. Remember, this is a randomized interventional trial. So this is a really great study to get exposure to the type of research that not a lot of even medical students are exposed to because of the sheer amount of resources and funding that a big study like this requires. Next up is Winnie. She's going to tell you guys a little bit more about our abdominal CT study.
Alright, so the abdominal CT study is one of our longer ongoing studies, and I think it's one of the core studies people talk about when EMRAs are talking about observation in the trauma bay. So at the moment, most traumas coming into the ED are conservatively sent for a CT scan. However, this can lead to excess radiation for the patient, which can potentially cause a lot of long-term health effects. On top of that, too many CT scans is also a huge burden on the hospital's resources in terms of money and time. So the point of the ABCT study is to create a clinical decision-making tool to help reduce this burden of CT scan overuse. And if you were to join EMRA and you are on shift, you will see that we have the clinical decision-making tool is a questionnaire with a set of certain data, demographics, and respiratory values. So overall, this is a really interesting study, and it pretty much allows EMRA's first-hand observations of traumas that come in, and you'll pretty much be in the trauma bay with each page that you receive to help collect some data. On top of that, with each trauma page, you'll also be deciding yourself whether to enroll the patient based on a set of criteria. So are they a blunt trauma or a gunshot wound, for example? Finally, after that, you'll go back to the office and you're allowed to actually abstract the data and look at all the different data points for your patient. So yeah, overall, ABCT I think is one of the most engaging studies that EMRA has, and it definitely gives you a lot of experience in the trauma bay. Next, we'll have Rish with troponin.
Hey everyone. So to start off with, the troponin study is an industry-sponsored project that has been conducted by Abbott Technologies. It's a company that you may have heard of in the past. But basically, the goal of the project is to evaluate the performance of a new troponin assay that has been developed by the company. And just as a little bit of background, troponin is a very essential protein in the calcium troponin tropomyosin complex which some of you may know is a very essential component in the muscle contraction system. And specifically, especially when we're talking about troponin in the context of this study, we're looking at the troponin involved in the heart. So basically the troponin that is found in that system within the muscle cells in the heart are very specific to that region, and that specific troponin isn't found anywhere else in any other part of the muscle system in our body. And what occurs is that whenever there's any type of myocardial damage to the heart, cardiac troponin is released into the bloodstream, and subsequently that can be detected by physicians in order to determine if there has been any type of heart damage or there is any heart damage occurring at the time that test is being drawn. And basically what this entire assay has done is being able to detect that specific troponin level with a higher sensitivity and specificity compared to the industry standard. And basically they're trying to evaluate and determine if that is the case. And they're trying to see if this new thing that they developed is up to standard with every other assay that is on the market, and if not better than those that are already on the market. In terms of our role as EMRAs, we're responsible for identifying qualifying patients. So in our office, we're able to determine patients that are coming in with specific chief complaints that are suggestive of acute coronary syndrome. And then based off of that, we go down to the resident in the ER and we talk to the resident and say, hey, is there any more inclusion or exclusion criteria that you can kind of give your perspective on? And then following that, as EMRAs, we're able to go and talk to the patients and enroll them to the study. And in general, this study really gives EMRAs a lot of opportunity to go down and speak to residents and patients, especially relative to some of the other studies, because troponin is a very high volume study. And one of the unique things about this study too is that we get to directly communicate with the ED laboratory, since they're the ones that are running the analysis on the blood. So following each enrollment, we do reach out to the ED lab and we get to talk to them about, hey, this is the patient that we just enrolled. And please make sure that you are following up on the blood samples that they're getting and you're, testing that blood. So that's kind of the gist of troponin. Up next, we have Itai that's going to talk you through the MI study.
Thank you, Rishabh. So hi, everyone. My name is Itai. I'm the study head for the MI study. The MI study, briefly, is a partnership between the UCLA Emergency Department and the Chi Lab at the David Geffen School of Medicine. The goal of the study is to assess correlations between neutron-1 signaling and characteristics of myocardial infarction, or MI, patients. Briefly, I'll just explain what a myocardial infarction is. You may know it as a heart attack, as it is known colloquially. So myocardial infarctions are typically caused by a rupture of plaque on an artery supplying heart muscles. So hypoxia or a lack of oxygen to the heart then causes irreparable damage to the cardiac tissue. And netrin-1 is a laminin-like protein that has been implicated in improving cardiac function post-MI. So preliminary studies by the Chi Lab have demonstrated that netrin-1 deleted in colorectal cancer, or DCC signaling, is capable of reducing infarct size by more than 50% while significantly improving cardiac functions, both ex vivo and in vivo. So preliminary studies have shown that netrin-1 is successful in improving that irreparable damage that results from myocardial infarctions, and the Chi Lab is interested in gaining more information about netrin-1 DCC signaling in human patients. So EMRA's role is going to be to answer pages, STEMI pages or ROSC pages, which are patients who have a spontaneous return of circulation. So these are patients who have had an MI in the last 24 hours. So EMRAs are going to be responsible for going down to the ED, finding the patients, asking the nurses to draw blood samples. The EMRAs are going to then transport the samples on ice and hand them off to the Chi Lab, which will be conducting further molecular analyses on the patient samples. And the MI study is a really great learning opportunity for EMRAs because they get to observe the resuscitation of MI patients, STEMI patients, ROSC patients in the ED. So these are very sick patients, and it takes a coordinated effort by the care team to resuscitate them. So if you're interested in emergency medicine and cardiology, this is a really, really interesting study. And just to conclude, the findings from this study could potentially be used to evaluate the clinical benefits of netrin-1 as a biomarker in cardiovascular illness and the development of novel therapeutic targets for myocardial infarction. And thanks. And next we'll hear from Miles for Impala.
Hi again, everybody. So our newest study is Impala, and it stands for Emergency Medicine Palliative Care Axis. So kind of delving into what palliative care is, it's essentially aims to lessen the burden of patients who have been diagnosed with serious and chronic illnesses through things like symptom management and social well-being. So Impala specifically is comparing two branches of palliative care, one of them being nurse-led telephonic care, and then the second being physician-led outpatient care. And then we're comparing these to kind of determine which of the two leads to better patient-centered outcomes in terms of social well-being, happiness, things like that. That's kind of the gist for Impala. And I guess to conclude all of our ongoing studies, I would have to say that one of my favorite things about EMRA is how often we get new studies and how often we get the opportunity to explore different fields of research. So with that, Sarah's going to talk to us a little bit about our upcoming studies.
All right, so as Miles just mentioned, another great aspect of EMRA is our dynamic collection of studies. We often have new clinical trials that are introduced to us and some of the older studies that are off-boarded, and we use the data to make research. And so to introduce three of our upcoming studies that our EMRAs will soon be screening for. The first one is ASTER, standing for acetaminophen and sorbate and sepsis, targeted therapy to enhance recovery. So this is very similar to Clover's that was introduced earlier because the study will be looking at a very similar population of patients who are septic and are suffering from low blood pressure or respiratory failure. And so the study's main purpose is to compare two different types of treatments, one being vitamin C administration and the other being acetaminophen administration, to see if these are effective medications or treatments for patients so that we can help reduce or prevent the chance of multi-organ failure in the renal system, pulmonary system, as well as the cardiovascular system. The second study that we are hoping for is ICECAP. It stands for Influence of Cooling Duration on Efficacy in Cardiac Arrest Patients. So this study will be investigating cardiac arrest patients who are now in a coma and trying to determine how long these patients should be under therapeutic hypothermia, which is a treatment where the body temperature is lowered in order to effectively reduce brain damage that occurs as a result of loss of blood flow to the brain due to cardiac arrest. And last but not least, we have STREPIC. This study is an investigational device study that will try to validate the effectiveness of a device that physicians can use to directly visualize the inside of a patient's throat to help detect what is known as pharyngitis, or more commonly known as strep throat. And so these are just some of our upcoming studies that we are expecting to see. As of right now, we don't really know what the EMRAs will be doing exactly, but we do expect them to screen through patient charts to find patients who are eligible to participate in these studies and helping obtain informed consent wherever necessary and appropriate. And next, we will be talking about some of our additional segments of the program outside of regular shift duties. These are called committees, and we have 3 of them. And these are another way of EMRAs to become more involved with the program, as well as to learn something new that they can gain out of the program. And so to start things off, we will have Kyle talk about the research committee.
Thanks, Sarah. So to start us off, what we have here is a description, and I'm going to let you guys read through that on your own time and kind of talk a little bit more about, the idea behind the research committee and why it's so valuable for members. So broadly speaking, the idea in medicine is that, oftentimes we have broadly established practices that are commonly seen as standard of care in the clinic. But oftentimes, there are limitations to certain practices or there are knowledge gaps that exist. And that's where clinical research comes in. Right? And overall, the goal of the research committee is to help members better understand what exactly the role of clinical research is in medicine and how to critically evaluate, the evidence that's, for or against many of these pioneering or novel treatments in the field. So as members of the research committee, EMRAs have the opportunity to contribute to current projects, including posters for recently completed studies that will be presented at Undergraduate Research Poster Day. There are often opportunities for faculty-led projects that members can jump onto with ED physicians. And we also have tri-quarterly EMRA journal clubs that give members a space to really discuss a lot of these new and novel topics in medicine and what current ethical debates there are around them and practice presenting on clinical research. So overall, the idea behind the research committee is to provide members with an educational opportunity where they can really have an opportunity to see what's out there, to explore the variety of fields that there are, and to see really how exactly clinical research and the data that we help generate actually ultimately goes on to become important in creating new rules for the future. So in terms of time commitment, we do have on average tri-quarterly meetings. These are our journal clubs that are about 2 hours each with a good amount of outside preparation as well. And really what this is just an opportunity for members to discuss, share, and learn more. So with that, I'll hand it off to Miles, who'll be talking more about training committee.
Yeah, so with the large number of studies that we're involved in as a program, there's undoubtedly a lot to learn, and I'm sure a lot of you guys are feeling a bit overwhelmed right now, but don't worry, that's why we have the training committee. So the training committee aims to equip new members with the knowledge and skills to function independently on shifts as clinical research volunteers. So pretty much the way this works is as a new member trainer, general members will show up to their normal shift, but in addition to performing normal shift duties, they'll also be trying to train the new members, being your guys' incoming cohort. So in terms of time commitment, it's just your regular shift. And in addition to that, there's going to be a quarterly meeting for training orientation, just so we can make sure that our training practices are standardized and that all our new members are getting a solid experience. So if you guys have a knack for teaching or even just want to improve on your own shift studies or protocol knowledge, be sure to join the training committee. Up next, we're going to have Henna and Davis talk about mentorship.
Hi, everyone. So as Sarah mentioned earlier, there's a lot of different opportunities that are open to EMRAs as part of the EMRA Experience, and the mentorship committee oversees a lot of those different opportunities and projects. They're projects that are both facilitated by the emergency department itself, and then as well as projects that are developed and executed by committee members. So one of the big collaborative efforts was improving the shadowing experience for our members. So committee members worked with residents and attendings in the ED to help develop an extensive document that outlines the best practices to help members have the most meaningful shadowing experiences possible. So as part of this committee, you're really there to help improve the EMRA experience in a variety of different ways. We also oversee EM event attendance. So EM events are put on by the emergency medicine staff. So these include conferences during which residents and attendings either discuss their own research, interesting case studies, or other relevant topics. And another event that our members have taken advantage of are simulation sessions. So residents basically run through the diagnostic procedure using models with varying conditions and then receive feedback on their procedure from attendings. So in addition to different events that committee members put on, we also have the unique opportunity to attend events put on by the actual emergency department, which is a really cool and unique opportunity for our program. Additionally, we put on pre-professional workshops. So this kind of goes along our goal to have like professional development opportunities for our members. So something we had at the beginning of the year was a pre-med workshop. So basically we gave members an overview of what they should be doing in preparation to apply for medical school. And one of our most recent ones will be our AMCAS workshop, during which we will have a panel of our members who have applied to medical school come and give us an overview of the application itself and then answer questions that our EMRA has previously submitted. We also have mentorship opportunities, and this is kind of one of the biggest points as in the mentorship committee, is to provide both physician and member mentorship. So in terms of physician membership, we have kind of two avenues. So one of them is our alumni mentorship program. So people who have gone through our program and have now graduated on to bigger and better things have actually come back and are willing to mentor our current members. And we also have different emergency medicine physicians available to help review our personal statements and help hold mock interviews for those of us who are going through the medical school application process. Additionally, we have intra-EMRA membership, so more senior members in the program are paired with more junior members and are able to provide guidance about how to go about in our program itself, but also just general academic tips, since they're all current students and kind of going through the same processes together. So kind of the big goals of having all of these different projects is to provide insight into different career pathways that are available to our members, to help those of you who are going through the application procedure, and also academic guidance, so just like general advice going through school, and then also just to help develop you guys as leaders and then as professionals in the future. In terms of time commitment, we do have 2 meetings per quarter. These are about 30 minutes each, and we discuss past and upcoming projects and really give those of you who headed different projects the opportunity to discuss them with fellow committee members. And there's also a lot of outside work depending on how many projects you want to take on and then what your role is in those projects, but that the time commitment is pretty variable from person to person and from quarter to quarter. And now Davis is going to talk to you guys a little bit more about the goals of this program and then kind of more projects that we have available.
Yeah, so the committee was essentially started with the idea that we wanted to help pre-medical students, whether you're an undergraduate or post-baccalaureate, to kind of progress to the professional world through guidance opportunities with current healthcare practitioners. And so the ways that we do that, if we go to the next slide, this is basically a resource summary slide, kind of highlighting a lot of the different workshops, mentorship pairings, some of the different events and presentations that we offer, as well as a resource folder. And so if you guys have any questions about this, definitely do feel free to ask us in the Q&A session. Now that you guys have an idea of what the program sort of entails in terms of studies and committees, some of the common questions you guys might have are more pertinent to applying. And so Radha is going to talk to you on the next slide about what we generally look for from our applicants.
So what kind of members are we looking for? First and foremost, we seek individuals who are passionate about medicine and healthcare, and specifically about the research that we do in the hospital. We look for individuals who show this passion through their dedication to responsibilities they may have, and by being dependable and reliable. Along those lines, communicating efficiently and conducting oneself professionally are essential in not only being a stellar member of this organization, but also to be successful in future careers. We also look for individuals who take on different opportunities to make the most of their experiences, who show attention to detail in various tasks, and ultimately those who make good judgment calls, whether they are inside the hospital or outside. And next we have Rishabh with time commitment.
All right, everyone. So just to kind of briefly go over time commitment, this is something that we typically do get a lot of questions about. Basically, at the completion of your training with the program, there is a 1-year full-time commitment to the program that you guys kind of need to be prepared for. This includes holidays and school breaks, so including summer, winter, and spring break. So that's just something to keep in mind. In the typical week, especially during school year, we have members be prepared to have 8 hours kind of allocated throughout the week for their shifts, and also kind of keeping up to date with any updates that we're putting out in terms of our studies. The way we split it up is there's a 4-hour regular hospital shift. So this is where you're screening actively for our current studies. That includes all the ones that we went over and even the future studies that we're planning to onboard. There's also a 2-hour clerical shift that we have. This is more for auditing purposes and doing follow-up phone calls for some of our studies. Some of our studies require a 30-day follow-up phone call, and we're the ones that actually do that. And another thing is there's a lot of paperwork involved in the program, and making sure that we're double checking our work is extremely important. So that's something that we also dedicate a little bit of our time to. And then that last bit for the other 2 hours, as I said earlier, is staying up to date with our studies. We have a lot of studies that are kind of actively coming in and coming out, and there's always updates for ongoing studies. So keeping up to date, being able to keep up with protocol updates is extremely important, and we ask that for all of our members. Another thing to keep in mind is that we have two general meetings per quarter that typically last 2 to 3 hours in length. And usually after that, we have events where all of the members get together. And these are all things that kind of take up a little bit of extra time. Another bit is also, as Hannah did go over, is that, and also all the other people that were talking about committees, it's extremely important to know that as an EMRA, the amount that you get out of the program is the amount that you decide to put in. Obviously, just outside of our hospital shifts and our clerical shifts, there is a lot that we have going on in terms of committees. So the amount of time that you decide to dedicate to pursue those different avenues is going to be more enriching of an experience for you. But I mean, at that, there is a little bit more of a time commitment by doing that. One thing that I want to bring up is that typically we expect all of our members to be present over summer for training purposes. Given the current situation that's ongoing right now, that we may have to be a little bit flexible with that. One thing we're keeping in the back of our mind right now is we're just keeping monitor of the situation, and we will update you through the primary, secondary interview process, onboarding process, to let you know if training does get deferred later into the summer. But for the time being, please be prepared to be able to come and be active over summer for the purpose of training. And one last point is that in terms of admission, we typically do not allow deferrals. So even if you decide that you get into the program and you're unable to make it to training, or you don't think that you'll be able to start shifts until later in the year, unfortunately you can't defer that admission. So you would have to reapply in a future cycle. And then on the next slide, I'll kind of give you guys some more pointers. Basically, in order getting involved with the program, there's a few other things to keep in mind. Is we typically take around 10 students per cycle, and that does fluctuate cycle to cycle, really depending on what our needs as a program is, and also how many studies that we have going on, and et cetera. So that number isn't necessarily fixed. All members that are onboarded initially will be in a probationary period until their training ends. And then one thing we really want to emphasize is that those that have applied in the past, we really want you guys to apply again. We look for growth in all the applicants that do apply. And one thing that we really do take big note of is, in that growth process, we want to see that if you do become an EMRA, will you be able to take that growth and put it into the opportunities that we make available to you. And with that, we'll be moving on to Hannah with volunteer office requirements.
So similar to a lot of other programs that also volunteer through Ronald Reagan, we do have to adhere to certain requirements that are set in place by the volunteer office itself. So we don't get a lot of leeway in terms of these requirements and expectations. So one of the major ones is making sure that all of your immunizations are up to date. This is especially important because our program is highly interactive and we're constantly interacting with physicians and with patients. So having all of your immunizations up to date is really important. One of the big ones is the TB vaccination, because it is one that needs to be renewed every year. So I just want to reiterate, given kind of the current state, you have to have the TB test within the past year, when we start volunteering. So don't worry about trying to get it done before the recruitment process happens. This is more in terms of when you would actually be onboarded and start volunteering. But we definitely recommend that you plan ahead and be prepared to make sure that everything is up to date if you are selected. And then moving forward, for those of you that are existing volunteers, so you already have an active badge and are volunteering through a different program, we do want to make sure that you have completed your minimum commitment with that program first. So if that commitment, for example, has 50-hour minimum requirement, you must complete those 50 hours before you can join our program. And we also expect to receive a reference from your program coordinator just to make sure that you are in good standing with that program and are able to do both concurrently. As Rishabh discussed, this program does have quite a large time commitment, so we want to make sure that you're able to both contribute to our program, but also that you still have good relations with any programs that you are currently in. And then another kind of strict requirement is that you must be 18 years of age. This is kind of just a legal thing. You are interacting with patient data, you are interacting with patients, so it's really important that you guys are 18 years of age. If you happen to turn 18 years old during the recruitment process, that's great. But if, for example, if you don't turn 18 until October or November, we recommend that you do apply during our fall cycle, since we won't be able to onboard you during this cycle. Next up, Gary is going to tell you guys a little bit more just about our application process.
Hi guys. So as far as our application goes, the link you can find to our application is right there. You can follow that link, or you can just Google UCLA EMRA and select the recruitment tab. That will take you to the same place. The application will be found there. However, the application is not open right now. You're gonna have to wait a little bit. So at the end of week 2, we will have info sessions on Thursday and Friday. These will be live Q&A sessions with the EMRA members you saw here and some other EMRA members, and we'll be there to answer any of your questions that you might have. And we'll give you an opportunity to submit questions in advance in a second. But the application will open after those info sessions. So those info sessions, again, are week 2, Thursday and Friday. That's April 9th and April 10th. And they're both going to be from 6 to 7 p.m. And then after the info sessions on Friday at 11:59 p.m., the application will open on our website. And again, you can find it at that link at the top. The application will be due exactly a week from when it opens. So that is Friday, April 17th at 11:59 p.m. Unfortunately, we can't accept any late applications. Please don't wait until the last minute. If you start the application at 11:30, you may not finish it in time. There may be technical difficulties. There's a few essay questions and some personal information we're going to ask for. So please don't wait until the last minute to fill it out. You're going to need to fill it out ahead of time. So your application will be read and scored by a panel of coordinators and managers. We'll take everything into account. We try and do a holistic view of your application. And we're looking forward to reading your app. So please make sure to get them in on time, and we're excited to read them. So next, I'm going to be talking about the interview process. So we have 2 rounds of interviews. So after we read and score your applications, the top scoring applicants will receive an invite to primary interviews by April 29th. And the first round, those primary interviews will be that next week. So primary interview candidates are expected to provide a few things. So first, you're going to have to give us either an unofficial transcript or a copy of your DARS. So DARS stands for Degree Audit Report System. So you can find that on MyUCLA, or you can go and find on MyUCLA your unofficial transcript. Either of those will work. You'll need to provide us one of those, a headshot, a resume, and at least one reference contact. And again, these interviews are going to be over Zoom. So just be prepared to have these digitally and be ready to send them in to us. And we'll give you an easy and convenient way to do that. And then so after primary interviews, we're going to deliberate and we're going to score you guys, and we're going to decide who we will like to invite back for secondary interviews. And so those decisions will be released by May 6th. And again, the secondary interview round will be that week as well. So secondary interview candidates will be expected to give us all the same things. However, you'll need to also provide an official sealed transcript. So we're going to work out a way to get an official transcript electronically. but you'll get more details about that hopefully by the live Q&A info sessions, if not earlier. We'll post that on our website. It'll be on our social media, and then also hopefully we'll give that to you guys by the live Q&A info session. So we're really looking forward to interviewing you guys, and make sure to follow us on social media. So I'll give you a few seconds to pause and follow that QR code. That'll take you to our website where you can follow us on social media. All right, and then next, you can submit questions for our live Q&A info sessions. Again, those Q&A info sessions are Thursday, Friday, week 2 from 6 to 7 p.m. The dates are April 9th and April 10th. So just follow that link. I'll give you another second to pause. And then you can also submit questions to our email. If you have any personal questions or anything after the deadline for the Q&A info sessions, please feel free to email us. You can also find that email on our website. And thank you so much. And we're looking forward to seeing you guys in the info session. We're looking forward to recruiting you guys. And we're very excited to get a new cohort of EMRAs. So thanks for listening. Stay safe and stay at home and help stop the spread of COVID.